Welcome to Medical Facts.
Warning signs of blocked arteries. One of the biggest threats to our well-being is something we can't see or feel until it's too late. Blocked arteries. It's easy to ignore small symptoms or chalk them up to just getting older. But these warning signs are your body's way of saying, hey, pay attention. In today's video, we're going to talk about the top warning signs of blocked arteries. By the end, you'll know how to recognize the early symptoms, so you can take action before things get worse. Trust me, knowing these signs could make all the difference when it comes to your heart health. So, let's dive in. What causes blocked arteries? Blocked arteries don't happen overnight. It's a slow process that builds up over time, often without noticeable symptoms until it's too late. It all starts when plaque, which is made up of fat, cholesterol, and other substances, begins to stick to the walls of your arteries. Think of it like sludge building up in a drain. Eventually, the more plaque that builds up, the less space there is for blood to flow. A lot of things can cause this buildup, like eating too many unhealthy fats, smoking, being inactive, or having high blood pressure. The more risk factors you have, the more likely you are to develop blocked arteries. It's a gradual process that often starts in your 20s or 30s, but can go unnoticed for decades. And even though it's happening silently, the impact can be huge, leading to serious health problems like heart attacks, strokes, or even organ damage. Warning sign number 1, chest pain or angina. One of the first signs of blocked arteries that many people notice is chest pain, also known as angina. This can feel like a pressure, tightness, or discomfort in your chest, sometimes described as a heavy weight pressing down on your heart. It can happen during physical activity or even when you're resting, though it's often triggered by stress or exertion. Why does this happen? Well, blocked arteries reduce blood flow to the heart, meaning it doesn't get enough oxygen. When that happens, your heart has to work harder, leading to that uncomfortable chest pain. It's important to note that angina isn't always a sign of a heart attack, but it is a clear warning that something is wrong with your heart's blood supply. If you experience chest pain, it's essential to take it seriously. Even if the pain comes and goes, you shouldn't ignore it. It's always best to talk to a doctor and get things checked out before the situation worsens. Warning sign number 2, shortness of breath. Feeling winded after climbing a flight of stairs or running a few blocks? That's normal for most people, but if you find yourself suddenly short of breath during simple activities, or even while at rest, it could be a sign of blocked arteries. When arteries become narrowed by plaque buildup, blood doesn't flow as efficiently to the heart or lungs, making it harder for your body to get enough oxygen. Your heart has to work harder to pump blood, which can leave you feeling breathless, even after minimal physical effort. This is often more noticeable when you're doing physical activities that you used to handle easily, like walking briskly, taking a jog, or even carrying groceries. The key here is noticing when shortness of breath seems unusual or more frequent than before. If you're getting winded faster, or noticing that everyday activities are starting to feel harder than usual, it could indicate that your heart isn't getting the blood it needs. In cases like this, it's important to consult with a doctor to figure out the root cause and take steps to improve your heart health before it leads to more serious conditions. Warning sign number 3, fatigue and weakness. We all have days when we feel tired or low on energy after a busy week at work, running errands, or juggling a million tasks at home. But what if that tiredness doesn't go away, no matter how much rest you get? If you're consistently feeling more tired than usual, it could be a sign that your arteries are becoming blocked and your heart isn't able to pump blood efficiently. When blood flow is restricted, the body struggles to get oxygen to the organs and muscles that need it. This can leave you feeling fatigued and weak, even after a full night's sleep or during activities that you normally find manageable. For some people, this can show up as difficulty finishing everyday tasks like walking the dog, doing housework, or even playing with the kids. It's also important to remember that fatigue from blocked arteries can happen without other noticeable symptoms like chest pain or shortness of breath. So, if you're experiencing ongoing tiredness or weakness, especially if it's unusual for you, it's worth speaking to a healthcare professional to rule out any underlying issues. Warning sign number 4, swollen legs, ankles, or feet. When your arteries are blocked, your blood circulation isn't as efficient, which can lead to fluid buildup in parts of the body, especially in your legs, ankles, or feet. This is often referred to as peripheral edema, and it's a common warning sign that something's wrong with your blood flow. Swelling in the lower extremities can be subtle at first. Your shoes may feel a little tighter, or your legs might seem a bit puffier by the end of the day. But as the blockage in your arteries worsens, so can the swelling. The affected areas might become noticeably swollen, heavy, or tight, and the skin may appear stretched or shiny. In severe cases, swelling could lead to discomfort or even pain. This swelling happens because your veins and arteries aren't working efficiently, and blood is pooling in your legs rather than circulating properly. While other conditions like kidney problems or pregnancy can cause similar swelling, the connection to blocked arteries can't be overlooked. If you're noticing consistent or worsening swelling in your legs, ankles, or feet, it's time to talk to your doctor. Getting ahead of this issue can prevent further complications, including ulcers, blood clots, or even permanent damage to your veins. Warning. Sign number 5, numbness or coldness in extremities. Another common warning sign of blocked arteries is numbness or coldness in your hands, feet, or legs. This happens because the restricted blood flow can't deliver enough oxygen and warmth to your extremities. When you don't get enough circulation, these parts of your body can start to feel numb, tingly, or unusually cold, even in warmer conditions. For many people, this symptom might start as a mild sensation, like your hands feeling slightly colder than usual, or your feet going a little numb after sitting in one position for too long. However, if the numbness or coldness becomes persistent, frequent, or severe, it could be a sign that the blood supply to your extremities is being seriously compromised. You may also notice that your fingers or toes become pale, or you might experience a tingling sensation, like pins and needles. In some cases, your limbs might feel unusually heavy or stiff. These are all red flags that the arteries supplying blood to these areas are narrowing or blocked. If you're experiencing these symptoms regularly, it's important to seek medical attention as soon as possible to avoid permanent damage or complications. Warning. Sign number 6, dizziness or lightheadedness. Dizziness and lightheadedness are sensations most of us have felt at some point. Maybe you stood up too quickly or haven't had enough water, but if these feelings start to occur regularly, it could be a sign of blocked arteries. When your arteries are clogged, your heart doesn't get the blood flow it needs to function at its best. This can lead to a decrease in oxygen supply to your brain, which might cause you to feel dizzy, lightheaded, or even faint. This dizziness often happens suddenly, without any clear cause, and might be more noticeable when you stand up after sitting or lying down for a while. In more severe cases, people might even faint, which is a definite cause for concern. If this happens to you frequently or with no apparent reason, it's essential to have it checked out. Dizziness could be a sign that your heart isn't pumping blood effectively, and untreated blocked arteries can eventually lead to more dangerous conditions, like a stroke or heart attack. It's easy to brush off occasional dizziness as something minor, but if it's happening often or is linked to other symptoms like chest pain or shortness of breath, it's important to talk to your doctor and get to the root of the issue. When should you see a doctor? By now you've learned about several key warning signs that your arteries may be blocked, but you might be wondering, when is it time to see a doctor? The answer is simple. If any of these symptoms, chest pain, shortness of breath, fatigue, swelling, numbness, dizziness, are persistent, frequent, or severe, you should seek medical attention right away. Even if the symptoms are mild, it's always better to be safe than sorry. Blocked arteries don't just affect your heart, they can also impact other organs, leading to a range of health issues. It's important to listen to your body and take these signals seriously before things escalate. Your doctor can perform tests, like an ECG or a blood test, to determine the extent of the problem and help you come up with a plan to manage or treat any blockages. The sooner you catch the problem, the better chance you have to prevent more severe complications, like heart attacks, strokes, or organ damage. Don't wait for symptoms to worsen. Taking action early is the key to protecting your health. How to prevent blocked arteries. While recognizing the warning signs of blocked arteries is important, prevention is always better than cure. The good news is, there are a number of lifestyle changes you can make to reduce your risk of developing clogged arteries in the first place. It's never too late to start taking steps toward better heart health. First and foremost, focus on your diet. Eating foods that are high in fiber and low in saturated fats, like fruits, vegetables, whole grains, and lean proteins, can help keep your cholesterol levels in check and reduce the risk of plaque buildup. On the other hand, avoiding processed foods, sugary snacks, and foods high in unhealthy fats can make a big difference in your heart health. Regular physical activity is another crucial part of prevention. Exercise helps improve circulation, lower blood pressure, and reduce cholesterol levels, all of which contribute to maintaining clear arteries. Aim for at least 30 minutes of moderate exercise most days of the week. Whether that's walking, cycling, or swimming, any movement is better than none. Other key habits include quitting smoking, which contributes to plaque buildup, managing stress, which can affect blood pressure, and maintaining a healthy weight. If you have high blood pressure or high cholesterol, it's essential to keep these in check with lifestyle changes or medication as prescribed by your doctor. How to monitor your heart health. Monitoring your heart health regularly is one of the best ways to prevent blocked arteries. If you're over 40 or have a family history of heart disease, it's a good idea to get your cholesterol and blood pressure checked regularly. Early detection can help you stay ahead of potential problems and manage any risk factors before they become bigger issues. You can also track your physical activity, eating habits, and even your weight to ensure that you're staying on top of your health. Many health apps can help you monitor your progress, which can be a motivating factor to keep making heart-healthy choices. It's not always easy to make these changes, but with the right tools, support, and knowledge, you can significantly reduce your risk of blocked arteries and live a long, healthy life. If you're unsure about where to start, don't hesitate to consult your doctor, who can guide you on the right path to better heart health. Blocked arteries may not always show obvious signs, but as we've seen, your body has ways of signaling when something isn't quite right. Whether it's chest pain, shortness of breath, swelling, or even dizziness, these symptoms shouldn't be ignored. The earlier you spot these warning signs, the sooner you can take action to protect your heart and overall health. Remember, prevention is key. A healthy lifestyle, balanced with good nutrition, regular exercise, stress management, and regular checkups, can go a long way in keeping your arteries clear and your heart strong. If you're ever in doubt, don't hesitate to consult a doctor.